Welcome back. Injuries are a part of most athletes' careers. Obviously, the better they get back, the better they are off in terms of competition. True. Now, Saran Dunmore joining us now from our Fit Club, and I've got to admit, my curiosity is so piqued with these. What the heck are these?
Well, you know what? I'm here, and I'm so excited to have my doctor here, Dr. Drynan from Active Body. And, you know, you use these on me quite often. Yeah. What are these tools? They look scary.
They do.
They do, yeah. At our clinic, we specialize in a couple different muscle techniques, muscle release techniques. Active release technique is our main technique, but Graston Technique is the other technique we use, and this is one we get the most questions about.
Yeah.
Because of the tools. They look scary.
They look very intimidating.
When they're used, though, they're not actually used in a rough way. They're very gentle, and they're essentially designed to break up adhesions and scar tissue, especially in the fascia. The fascia is like the connective tissue coating around a muscle. And if that's getting fibrotic, tight, and stiff, then it's going to basically mess up how that muscle moves, and usually creates pain and affects function. So.
Okay, so people who have pain, it could be
muscles anywhere in your body, pretty much. Sure. It was made popular by athletes. So we treat a lot of IT band syndromes and other things, but you can use it anywhere in the body, pretty much.
Okay.
So it's good for injuries both with athletes and non-athletes.
And non-athletes, because a lot of people out there are walking around with pain, and that's not a good thing.
Right. It's essentially a technique that breaks up adhesions from chronic repetitive motion injuries, and honestly, people just sitting in a computer typing all day, they're getting a lot of chronic repetitive motions too, and this technique works great for that.
And for me, since I am so active and I work out all the time, I come to see you more often than I'd like to, but I have to because I want to stay out there and I want to stay healthy. So show us how this works. You're going to do a little Graston on my forearm.
You'd mentioned that your forearm was giving you some trouble. Yeah. So there's a few different muscles through here that can often give people pain. You were getting pain right around the
the elbow.
This is like the typical tennis elbow spot. And so if the fascia through the musculature through here, the finger extensors are getting really tight, it's going to pull on that spot. And so we'll use one of the tools here that just contours to those muscles.
Look, I was ahead of the game. I put it on my fingers.
Oh, you're good. Just a little gel.
So just show us quickly how this works.
And then bend your fingers down, and then we're going to basically just kind of gently go in and smooth. If it's an area that needs it, you'll feel it.
Sure.
If it doesn't, it'll feel like nothing.
And you can use these tools to go a little bit deeper, because right now that doesn't...
It's not too bad.
It's not too bad. Right. But sometimes, you know, people will say, well, does it hurt?
Right.
It hurts a little bit, but I think the pain is a lot worse than this. This is temporary.
It gets rid of the pain, so people find that more important.
Yeah. So it's really important for me, at least, to get sort of immediate results. Right. How quickly can people see results with Graston?
Oh, people see changes within a couple treatments usually. So that's my favorite thing about this technique or the other technique we use, active release. They both generally work fast if they're going to work at all.
Perfect. So how can people find you, Dr. Dillon?
Our clinic's been in the South Loop of Chicago for over 10 years now, Active Body Chiropractic, and our website is www.activebodychiro.com.